When you get sick with something like the flu, you're just focused on the fever, the aches, the coughing, right? But what if the real danger, the big one, isn't the symptoms you feel at all, but a silent, hidden threat to your heart that sticks around long after you feel better? Today, we're diving into the really surprising and serious link between common viral infections and your heart health. I mean, we all think of the flu as just temporary misery. You're sick for a week, you get over it, and life moves on. But what researchers are finding out now is that for your heart, the story might not be over. The consequences can linger in a really, really serious way. And that brings us right to our first section, where we're going to uncover a connection that is, frankly, pretty shocking. We're talking about a direct line between getting a common virus and having a major cardiovascular event. Let's just start with a number that's going to make you sit up and pay attention. According to a huge review of the research out there, a COVID-19 infection can triple your risk of having a heart attack in the weeks that follow. 3 times the risk. That is just a wild statistic. And hey, it is not just COVID. The common flu, the one many of us get every few years, actually brings an even higher short-term risk. We're talking about a 4 times increase in the risk of a heart attack in the month right after you get over the flu. 4. And this quote from Dr. Ziad Al-Ali, a clinical epidemiologist, just really brings it all home. He says, infections are generally not benign. It's so simple, but wow, is it powerful? It forces us to completely rethink how we look at these illnesses. They aren't just a minor inconvenience. So let's keep going and see how this all builds up, because you might be thinking, okay, that's a couple of scary stats, but these aren't just one-off findings. The evidence for this connection has been piling up for years, and it's painting a very clear picture for scientists. So the big analysis we're pulling from here, it wasn't small. We're talking over 150 different studies. And even though they were all a little different, the main takeaway was incredibly consistent. There is a clear link between viral infections and a higher risk of heart disease and stroke. The sheer amount of research here is just impossible to ignore. And get this. This isn't just about viruses that give you a cough. The pattern is much broader. The list of culprits includes the flu and COVID, but also the virus that causes shingles, plus hepatitis C, H.I.V, and even RSV. It's a whole rogues gallery. This quote from Dr. Al-Ali, again, just nails it. It may start as a respiratory virus, but that's really the tip of the iceberg. What he means is the sneezing and coughing, that's just the start. That initial infection kicks off this whole chain reaction that can have serious downstream effects on your heart and your blood vessels. All right, so the big question, the one you're probably asking right now is how? How on earth does a virus that just gives you a cough and fever end up damaging something as important as your heart? Let's break down what's actually going on inside your body. Well, it turns out there are really 2 main ways this can happen. In the short term, when you're acutely sick, the infection puts immediate stress on your heart. Your heart rate skyrockets, your body's working overtime, and sometimes your heart muscle just can't get enough oxygen. But the real danger, the sneaky one, is what happens long term. And the key to those long-term problems is a little something called chronic inflammation. The best way to think about it is like a faulty fire alarm in your body. The fire, the virus, is out, but the alarm just keeps blaring. This constant, low-level alarm can start to damage healthy tissue, especially the super delicate lining of your blood vessels. So let's walk through this step by step, because it's a pretty scary chain reaction. First, the virus can directly attack and rough up the inner lining of your blood vessels. Your body's response? Inflammation. Now, if you already have some plaque built up in your arteries, this inflammation makes that plaque angry and unstable. It's like poking a hornet's nest. That unstable plaque can then burst open. Your body rushes to form a clot to patch it up, but if that clot is too big, it can completely block the artery. No blood flow means no oxygen, and that is what causes a heart attack or a stroke. Okay, I know, that all sounds pretty terrifying. But hang on, because the whole point here isn't to scare you, it's to arm you with knowledge. So let's talk about what you can actually do about it. Let's build your personal defense plan. All right, part 1 of your defense plan is actually super simple. Do your best not to get sick in the first place. As the experts point out, we have vaccines for a lot of these viruses. And hey, even if a vaccine doesn't stop you from getting sick entirely, it can seriously reduce how bad the illness is, which might lower your risk of these scary heart complications. Now for part 2. It's so important to remember that a virus is just one piece of a much bigger puzzle. Those classic risk factors for heart disease, they are still the most important things to get a handle on. We're talking about controlling your cholesterol, managing your blood pressure, watching out for diabetes, and of course, not smoking. These are the absolute fundamentals of keeping your heart healthy. And this is maybe the most important thing to hear today. Getting the flu or COVID does not mean you're destined to have a heart attack. It's a risk factor, not a guarantee. What really, truly matters is your total risk profile. The virus is just one more thing to be aware of in that big equation. So let's wrap this up with this clear, no-nonsense advice from Dr. Al-Ali. You can't go back in time and uncatch a virus, but you absolutely can pay attention to all the other things you have control over. By managing those, you lower your overall risk. So the big takeaway isn't to live in fear of every cough and sneeze, but to see it as yet another powerful reason to take your overall heart health seriously.